So I just wanted to make sure everybody was aware after our conversation yesterday and making a decision. I was the one who turned Saphire out in our big I2 pasture. And on the way out, I noticed, so she's had a little bit of a scuff in her right hind toe, which we attributed to scar tissue and the large wound on that leg. But she had a really significant toe drag in both hind legs and a little bit in the front. And she tripped really badly while she was paying attention to where she was going. She did not go down when I was taking her out. And then yesterday, right before I left, I just kind of sat and watched her for a minute, and she was standing. She was just standing, and all of a sudden, both her front legs buckled. She, again, did not fall, but those things are abnormal. So I just wanted to let you guys know I haven't observed either of those behaviors in Saphire until this. So I think that whatever we have going on neurologically is progressive.
Speaking of West Nile, I'm glad Saphire doesn't have it, but this was probably 2004, maybe 20 years ago. We got called out to get a 3-4-year-old thoroughbred mare, and they're like, "We need you to surrender." I'm like, "Okay." So we went and picked her up, got her in this little pen, and she was all muddy, and she was super skinny.
You don't have to put the mic on your shirt so you're not waving it around.
And brought her back and put a pen down, put bedding down. She laid down a lot, and she drank tons of water excessively all the time, and she was just super skinny. But after a while, she got her appetite up, and she was a windsucker cribber, and I was like, well, maybe that's why she's skinny. But she gained her weight back and got her adopted, and then I got a call from the state, and they wondered if the horse that we had that had West Nile survived, because these people had a horse that had West Nile, and they gave it, they're like, in our notes, they say they gave it to you guys. Did it survive? And I'm like, what?
That would have been nice history.
Nice to know, but they were afraid because if they said, hey, the horse has West Nile, that we wouldn't take it. But she ended up being totally fine, riding horse, no neurological problems, but I was like, what? When I got the call, and they're like, we assumed she didn't make it, and I'm like, anyways. People do weird things when they give us animals sometimes.
So this is our outside staff meeting, and today we're standing around telling stories and talking and trying to decompress from yesterday's intake right before we go out and do the other 13 that need to be done.
We're kind of stalling because some of us have a Zoom meeting that we're going to be talking to somebody in another country that potentially could be joining our team. So that's all I'm going to say.
All right, Justin, it's just you and me today.
Yes,
How did it go yesterday, and why is it only us?
Well, Haley and Macy's grandmother unfortunately coded yesterday, so it's me and my dad who's on the other side of that camera. We're the only people on the media team, because John's gone too, and Faye, so we're struggling, but we got to push content for you guys.
Alrighty, and how did the videos go yesterday?
The members video?
All of the videos.
Oh, well, all the videos went pretty well, I would say. I mean,
you haven't looked at stats yet this morning?
I have not.
Oh, let's pull up the stats, see how it's going.
So it got about 10,000 views in 13 hours, so that's pretty good.
That's really good.
That's pretty good.
How's it going today, Lynn?
It's going good. Just getting caught up with yesterday's buyout, entering the animals and answering emails and getting ready to make calls. So pretty much that's what is going on today.
Do we get a lot of response from buyout days, like a lot more interaction, communication? Or?
Yes, we do. We do. A lot of people wanting to make donations. A lot of people just excited about seeing the new horses as they're uploaded. And I mean, it's very exciting.
No, you're good.
Jeez.
I know.
I was literally on the way to fix my hair.
Well, that's rough. Your hair looks just like it did yesterday. So
No, it doesn't.
Anyway, so
it's so much more poofier.
How did intake go yesterday?
Intake. Okay. Intake yesterday went pretty good. We were able to get through about 15 to 18 horses. We still have hopefully about 13 or 15 left up there. So we're just going to load up really quick with the vets and run up there and finish intaking the rest of the horses.
This is the cute little pony you guys saw in the almost live intake yesterday, down in the vet hospital, getting everything he needs done. And pretty sure it's a girl. She got a really good brushing out yesterday, and as far as I know, completely blind, but what an adorable little mini. Alrighty. So right now, Dr. Lydia, Tani, and Angela are on a Zoom call, and Dr. Gina over there is listening in to a foreign country. And there's going to be some pretty big news. We're seeing about adding someone to our team, and this is going to be very big news if it actually happens. So we'll see. Stay tuned. This is just your first little sneak peek. This is little Honey. She's getting her water filled, and she's got her hay, and she's got her hay in her water, which Caitlin's going to clean out here real quick. And but Honey was surrendered to Horse Plus a while ago, and she's had a really rough go in life, and hopefully she can get just the perfect home that'll give her all the love and attention that she desperately craves, because she's such a sweet little donkey. And now the water's all nice and clean. Honey, you need to stop putting your hay in your water, okay? And somewhere back there, where's the goat?
Hiding.
There's a little goat back there at a broken leg and it's hanging out with Honey. So this is kind of like the we've been abused and broken pen, a little stall. And there's the goat. But they're becoming really good friends. Time to load up the vet stuff to go on up and get the rest of the animals intaked that we rescued yesterday. Blessing is giving all the help she can, which is none. Did y'all go ahead and charge that thing last night, or just going to be dealing with dead batteries again? We'll see. Yeah, who knows. Takini is the first horse up on the schedule for gentling today. How you doing, Takini? It's a cute little horse. And there she goes. Round and round the round pen for a little bit. And while Amber is working with Takini, Shane is out here working with this little horse. The vet gear is all loaded up, but the vets are still on the Zoom call, so we'll just wait. How'd the Zoom go?
So we did a Zoom meeting with our veterinarians here. We are potentially looking at bringing a veterinarian from the Philippines here to Horse Plus. It would be the beginning of next year, but these things take time. So this is a veterinarian that's in the Philippines that wants to get a license here in the United States to work as a veterinarian, but they need a place where they can come. Can't work as a veterinarian, but could work as a vet assistant and take the test, and it's just a long process, but she seemed really nice, and who knows, maybe she'll be joining our team. But it was just the first initial Zoom meeting. Dr. Lydia's been talking with her a lot, and she's a high volume spay neuter vet, which we're gonna be building that spay neuter clinic, so we need a high volume spay neuter vet. So we'll see what happens, but it was a great meeting.
And Haley is playing with a puppy. Such an adorable little puppy, teaching it some human manners. but it has the biggest paws.
I believe this puppy came in as a stray, and we found its owner. So that's always a really good thing. We do accept animals in here, and it's always really exciting when we're able to connect a lost dog with their owner. So I think that's what's happening. I don't know if the owner's coming today, but we've, as far as I know. And then this kitten, oh my, this kitten.
Oh, Blessings. We already played with Blessings earlier.
Yes.
This kitten
It's the cutest little thing on
is
earth.
the cutest, most adorablest. Like if you want a sweet, precious kitten, and she's very grown up. She's very mature for her age and her size. She was out here this morning with all the big cats and like just purring and standing there big and tall with the rest of them. She's adorable. She's up on all her vaccines, been spayed, microchipped. She just needs a very loving, wonderful home. I cannot adopt her because
One got in your Jeep last night, didn't it?
on photos of the day yesterday, there was a picture of a flower pot, and like one side just kind of looked black. Well, there's this black cat that just is very friendly, and he always loves hanging out in my lap and everything. Well, I worked late last night, and I got in my Jeep, and I was putting stuff in my Jeep, and I was like, I don't think anyone's gotten in my Jeep. And then I started hearing noise in my Jeep, and the cat came up and put its paws on the front dashboard of my Jeep and was like looking at the windshield. So that cat chose me and became a stowaway and came home with me. So a forced adoption on the cat's choosing. So I can't adopt another one. But if you want a kitten that is just as sweet, it gives kisses, just adorable, reach out to us. This little kitty's not gonna last long, and
People are gonna want to take her.
you gotta get on it first. This is an adorable, precious baby. Mwah. Yes, you are. Yeah, you gonna lick my nose. I just looked over there, and Amber has got her horse out, leading it around. This horse was wild and unhandled on Monday, and Amber got here Monday afternoon. It's amazing having this Navajo training horse gentling program here, and already just in the few days, Haley was like, oh, all these horses, like these ones are started under saddle. It's amazing, and they're gentling them. It's not a forced thing. They're working with the horses, and such huge amazement, like blown away. Look out there.
What's happening?
Who is that?
That's Sebastian or Takini.
It's Takini.
Oh, what a good boy!
It's a little wild hooligan.
We had to squeeze shoot him to castrate him like, what, 10 days ago?
Yeah.
Monday morning he was wild.
Monday morning he was like wild. She was out there picking up his feet,
What a good
leading him around, leading him on top of the pile.
Look how calm he looks. Like you were talking about Saphire head pressing against
No.
I don't want to look at.
No. Okay, she's going to lead him off. How's he going to do? He's doing so good.
Oh, baby.
So this is it. This horse is done doing real well. Very cool.
I am so impressed. I saw her out here leading him around. And I went and told the vets, and they were all looking out the window, amazed. But I know he's not the only horse that has been gentled in a day and a half. So
that was Takini that you saw. Right now we have Bentley in the round pen, so he's just kind of getting flagged work and everything. But yeah, they have made a lot of progress. Most of our young colts that we brought down, they're doing a lot better. We have, I think, 5 that are now halter trained.
halter trained.
And they are leading, as you can see, Takini behind you. Right there. Show Takini. Yeah.
Bringing him back out.
But yeah, so there's Takini, and then we were able to do 2 riding evaluations, both Winston and Dustin. Dustin's about a level 2. Winston we put at a level 2 also. They're just very calm. Another horse we have is our Mustang Surprise, Torito. He, as you guys first saw, like he bucked off Caleb and everything. The first, So we put Shane on Torito, and yesterday he only crow hopped once, which is a lot of progress. And we were able to do about 3 full rounds in the round pen on saddle riding. So Torito is making a lot of progress.
Nice. So in a day and a half, we've gotten how many unhandled wild youngsters
We have
gentled and
gotten
leading?
About 5.
5
Yes.
in a day and a half. From unhandled, the vets can't handle them. We have to run them into chutes, causing stress for them. And they're now leading.
Yes.
And
they are now almost able to be caught out in pasture.
Wow.
Yes.
I am thoroughly impressed. What do you think of this?
It is amazing to see, just because I was so focused and overworked with a lot of these babies, and now to see them actually having a good chance and just being able to find a good home.
Yes, we had like 20 baby horses. Like, how are we going to get them all?
We have a lot of babies.
How are we going to get them all leading? I mean, look at that. That's
Takini.
amazing.
Yeah,
It's amazing. Like, the vets were like, 10 days ago, we had to have him in a chute and like to get him castrated. And this program, if we can get these young horses gentled like this, they can be led into the surgery room in the hospital like this.
That's slowly what I'm having her work on.
It's amazing.
Just having him walk in and out of the training barn. So
and they can walk
surfaces.
through the vet hospital too.
Yeah.
They
are making progress.
I'm very impressed for a day and a half of
later
horse
on
gentling.
later on this today, we're gonna have them try to put saddles on Mangus and Barney.
Wow.
So we're hoping we might have a little bit of a rodeo, but
we'll see what happens.
Yeah.
They're doing amazing.
Yeah,
Like,
the babies have come a long way.
Very impressed in a day and a half.
Me too.
Wow.
All right, we're heading up to quarantine to get the rest of the horses intake and see how it goes. All right, we're almost there. Yay, we're in quarantine. All righty, here we are up here in quarantine, getting ready to go. Haley's getting everything unloaded because we made it up here before the vets walked up here. Why did they walk, you ask? Because Dr. Lydia wanted to.
Haley, I can keep unloading. You want to get us a horse?
IXB number.
To live.
Not much left. So Tanya is bringing this horse back in. They looked at him yesterday, but he's just such a gentle boy that Connie's hoping can go for a reevaluation. He's completely blind. He's a stallion, and
We were told he was 20.
told he was 20, but he ended up not being 20. He's like 6, much younger. So
Completely blind.
What a good boy. Easy. Oh, we don't have the B numbers.
I think he's supposed to be 421, but I'm not sure.
Good boy. I'm going to close behind you.
We all talked about him as a team last night, and he was supposed to be in his 20s, we were told, maybe 30s, and he needed euthanasia is what we all decided because he's a stallion and his eyes. And I took him into the chute and he tried so hard, just like he did right now, to be so willing. I was like, I can't do it. So I put him back, and the vets are going to look at him because he looked a lot younger to me. So we're going to check him out again, but I'm really hopeful he'll be okay because he has a really big heart of trying to be good. He's being such a good boy.
he's got pus coming out.
Sorry, buddy.
One of my teachers hates that word.
Actually,
Purulent.
I don't like it either, because if you can't document that there are degenerative neutrophils, you technically can't call it pus.
What was that word? Degenerative neutrophils?
Degenerative. The neutrophils have a little like blobby half C that shows that they're actively fighting infection. Hi, Bubs. I'm right here. Okay, good boy.
Hey guys, how y'all doing this morning?
Boy.
Getting his face all cleaned up. Alrighty. You little guys.
Printed in the office if we need more. Thank you.
Justin getting a little time with him.
I heard my name.
Yep.
Oh, he's been castrated? It's okay. Hey, Jordan, will you give that guy like 3 or 4 flakes of hay too? And make sure he has water. Thank you so much. Thank you. He's been really great. I think you can safely do it. His teeth look good.
Cool. That's
I need to take another one with the plate held higher this way. What happened? Sorry. That one didn't fire. Ready?
Sure, a lot straighter of a teeth than that one horse.
Yeah. Nope. I need his head held over here. A little bit of movement on my end, but we gotta try that one more time.
Yeah.
Imaging at this job.
Right.
If that didn't get, we have this really, really sweet, completely blind stallion. In the chute, the shipper said he was totally unhandled, and he clearly has been handled. He's been really, really sweet. He yields well to pressure. He's got multiple abscesses on his face, and it looks like he fractured the left side of his facial bone a long time ago. So he's got infection. He's a stallion, so he needs to be castrated. And his eyes are currently stable, so he's not an emergency enucleation, but over time, as those eyes shrink, the lids are going to roll in. So he does need at least the left eye enucleated, maybe both eyes enucleated. But I vote for right now, we run a CBC chem, we go ahead and microchip and vaccinate him and get him dewormed and put him somewhere safe and away from others. I think the nasal discharge hopefully is just related to those facial abscesses, but we don't want him to be an infectious risk to others. That is a fantastic idea, and we already have a box going to IDEX. I did clean his nose out, but I think we can go a little higher up there and get some schmoo.
Now he's getting his pokies, getting his Exceed and microchip and vaccinated. And yeah, he's gonna be hanging out for a while with us. That's so awesome.
You want to come in the chute so we can run some blood work on you, please? She's got a very upright right front. You good girl. You're a very good girl. Someone loved you enough to take your eye out. Come on. Oh, sorry, Jordan. Hi.
All right. Easy. Come on. I'm just showing him where the water is and the hay. Easy. Good boy. Come on. Come on. Good boy. Come on. That's where the water is. Come on. Come on. Come on. Come on. Good boy. Good boy. This is the barn. Come on. Come on. Good boy. Good boy, you're doing good. So he's eating. We left a breakaway halter on him with a rope just to make our interactions with him better. We don't have to like try to move him away from us to try to get him into a shoot area. He's eating, he seems happy. He does have some health concerns, but he tries so hard to be a good horse. He may have been halter trained when he was much younger as a foal or something, and then they stopped. Like, he kind of has the concept, but he doesn't know really what to do. But he tries incredibly hard to be a good boy. So we'll see what his future holds, but he's just gonna hang out here. This is gonna be his pen during quarantine.
You want to come out so I can look at your teeth better? She's not easy to catch, but she seems very halter broke. Good girl. He's got both maxillary arcades are worn to the level of the gums. Mandibular arcades have a little bit. There's just, what's that? I would call her a quarter horse. Her face looks very quarter horsey to me.
Uh-oh, the horse can't see Caitlin on this side, so is it going to react negatively? Just going to be just fine. I think he'll be just fine. He's like mid-20s and he's been vaccinated before.
Very good. Rabies vaccine.
Is that the rabies vaccine? Or?
Yep.
Yeah.
R&R, rabies goes on the right.
And rabies has to be administered by a
veterinarian. Yep. Or RVTs can administer rabies vaccines under the supervision of a vet. We have to be there. Big hope. Good girl. Hey, Jordan.
So someone cared enough about this horse at one point to remove her eye. One thing that's kind of interesting with eye removals is their muscles are still there and they still react to blinking, like when the other eye blinks. But if you touch the skin, I know you're trying to see the horses over there, she'll blink. Doesn't hurt her at all. It's just what it probably feels good to kind of get it cleaned out from the little debris they get in there. But she'll try to blink even though she can't. Huh. Does that feel good?
Going off to quarantine pasture. We got some mules up next. A little white one, a couple brown ones. Hi guys.
Now we need a volunteer to go in the chute. You're okay. What do you guys think? Anybody want to go in? Hi. You're all right. Here we go. There we go. Hi, sweet
All right,
girl.
little white mule went in first. Little girl.
Hi.
This is
You're a good girl. Easy. You don't need to turn around. Very good girl. Okay. Good girl. You gonna kick me? Good girl. Good girl. I can't really reach it over there.
Yeah, because even the ones I thought matched when I looked
Licking
deeper,
and
they
chewing while Dr. Lydia is checking your lungs. That's so cool. A cute little mule.
I don't mind if you try to pull blood, but I don't think she's had a lot happen to her at all. pull up vaccines. Oh my goodness, that poor baby. Oh my goodness. I have never seen a fracture right there. This poor little guy, he was only 3 years old. And he was in a ton of pain on the left front. We could tell without radiographs that he was extremely uncomfortable, and the angle of his leg couldn't have been explained by anything other than a fracture, but that is just horrifically bad. Oh my goodness. So there's supposed to be a joint right there, and this is just all.
Yeah. It was the right thing.
Oh my goodness, yeah.
It's a nice thing with the x-ray is
Poor thing.
We knew it was the right thing from what he was presenting, but the x-ray confirms it, and now we have knowledge of what this poor little horse went through. It's really sad.
Alrighty.
No visual on this eye. It's good.
This here mule is possibly never haltered before, and
Maybe never had treats before, but they're delicious.
candy's candy no matter who
That's
you
right.
are.
That's right. That's a good job. If it doesn't work, we'll sedate him or squeeze him.
Mule
This
number 3 is in the.
This mule thus far is the
scale.
friendliest. You don't need to turn around though, okay? He likes cookies.
Yep, can't turn around.
Yep, so let's open this and let's also open the front one. You don't look very asleep. I guess wrong. But at least you're not like falling down. Why is your head bleeding? Why did you do that? It was not smart. It was not smart. If you want to trade jobs with me, Dr. Gina, I'm happy to do that as well.
This is some very limited room in here to work.
I'm not sure how well we were lined up, but hopefully that was diagnostic. Definitely got hook and wave.
See, it's not going to hurt you.
X-ray number 1 doesn't look very good.
Yeah.
Let's see how this looks.
Okay.
Sorry, buddy.
Oh boy. Yeah. Got opacity changes on the left.
Yeah.
Let's try to sedate him more.
This mule managed to get his little head a little bit of a bang on it, so we're gonna staple it up. The vets are gonna staple it up, and it'll be just fine.
You're gonna have to hold still, sir. We might have to squeeze him for this. I don't think he's still squeezed. Okay, let's.
Well, you can't see much, but Dr. Lydia is.
I gotta get the angle this way, so I'm gonna need you to open that a little bit, and I'll tell you where to hold it. Okay, so Haley.
Got your little owie, and we're trying to get some staples in there.
I know the last time I approached you.
Well, no staples, just suturing, so this will be fine.
This is actually preferred because these are gonna dissolve, and staples don't dissolve, so.
Perfect. So we'll give him some antibiotics and he'll be fine, or?
I don't think he's gonna need them. I'm gonna do topical.
Gotcha.
A topical wound ointment. And as long as his immune system is up to snuff, we should be fine without antibiotics. If this was a really contaminated wound, we would be giving antibiotics. It was a big gash, sir.
And the mule's all done, stitched up, got everything vaccinated, everything good to go.
Okay, ready? Oh, this one too. I'm opening this way. Here, do we want a twofer? Not this one? Even though you're supposed to be sedated, we don't think you're actually that sedated.
So cute.
Your head looks maybe a little big for this one. Let's try this first. Here we go. Definitely feels like a halter has happened in her life before.
Are you a lady?
Emily, do you want to go over on the other side so you can tie this for me, please? Oh, we are long in the tooth.
Are you old?
Yeah.
What are we thinking?
Let's look over here. 22.
That's not too bad.
Yeah, for a little mule.
I got 21.
Can you turn around?
We getting some dental radiographs on this little mule too. She's older, so let's make sure her teeth are all in good shape.
And drop the plate a tiny bit. Yeah. A little bit of patient movement. Oh, she has a lot of tooth root left. Can we try one? I didn't get the whole arcade. Can we try one further rostral? Like closer down towards her muzzle. It's a little obliqued. Yeah. Oh. You want to come look at this, Dr. Gina? Sure. So the first one that I took, I was like, oh, great. Things look pretty good, right? But I didn't see the whole image and what's happening in her case. So here's periodontal ligament. Here's gum line right here. So we've got
No teeth on the top.
a few teeth that have an occlusal surface, but then the mandible is like super, super overgrown. So here's periodontal ligament, here's gum line on the top. So she only has like
A little bit of teeth.
a tiny, tiny bit of teeth. And then like this is crazy overgrown up here. So this is the first one I saw and I was like, oh, great. I don't feel great about this. This feels like we're probably at less than 30%. The other tooth that worries me though is this one. Look how different the angulation on that molar is.
Agreed.
And then we've got opacity changes down here in the mandible too
Yeah.
at these tooth roots.
Yeah. Those look
Uh-huh.
not great.
Uh-huh. Her body condition is good right now. Do we want to... I also want to check under her tail for any masses. I'm very concerned about this dental arcade. She's got less than 30% of her teeth. So she's going to be at risk of colic and choke and dysbiosis.
Hello, you're sniffing the camera. Now you're gonna get yourself some food. Good plan. And another white mule. Cool.
Okay. Oh, you totally know what a halter is, and you know how to evade one. You pick your head back up, please. Hair into this halter tie, which is
Not ideal, but it happens.
not ideal, but should work.
So there is a comment.
This guy turned around as soon as he got in here, and now he doesn't want to turn around back around.
Hi. You're very adorable and very naughty. Oh, you're a baby. So we are 3.5.
Thankfully it's not donkey.
It's part donkey.
Okay.
Full mule.
Poke on this side.
Okay. You can use the rest of this big white mule.
Good mule.
Haley,
A good little baby.
you did a really good job on that last one.
Oh, strangles up the nose is no fun for anybody.
But having strangles is even less fun, so it feels worth it. Oh my goodness. These boots have really poor...
Wow, what a good little
It's the
mule.
last time he'll ever do that willingly.
It's been 1.5 minutes and he's still not out. Come on, bud. He's like, whoa, I can get out. There we go. Another white mule. See how he does. And of course, he immediately turned around right away.
Okay, let's get this stuff that everybody keeps tripping on out of the way here. Let's get that. I'll get it.
And you're going to be the next two up.
Young-ish.
Yeah, maybe like 8. Between 6 and 8. Good boy. Heart rate's a little elevated, but
He was a thing naughty.
very good job. No palpable masses.
No cancer under your tail.
This one's definitely had handling. You just don't like this eye being messed with, huh?
I don't think he likes his face messed with.
Well, he's got swelling and a scar over this right eye, but he's also got a more recent injury over it. So we're gonna do all the things and hopefully get him a good home.
And the icky strangles vaccine.
Haha! Got you. Oh, that's disgusting.
Alrighty, this little mule's going to be coming out. No health concerns. Not terribly old. Ready to go to quarantine. Open gate before it turns around. Oh, careful, bud.
Let's go ahead and put her straight in the squeeze, you guys. Hi, friends.
And this is the biggest white mule we got.
Easy.
Pretty funny. How many white mules we get? Like 4 or 5? 4 white mules. Nice.
Okay. Easy. Yeah, don't look over there. Easy. Yeah, you're pretty young too. Under 10.
Nice.
But I need to take a little closer look at those cups. I thought I had a really good hold, but...
So Dr. Gina just got bit.
Are you okay?
Yeah.
But she's okay. That's awesome. Good man.
They look all filled in.
Yeah.
That usually happens between like 10 and 11.
It? Okay. He's good girl.
Colts and tails.
Someone's itchy. Look at little mule's all back there gonna be scratching himself. That's funny.
You guys want treats? go. Oh, we know what the cookies are. You're all right. You can take a minute. The Arabians in this group really know where they do and do not want to go.
All right, so the microphones died, so I'm gonna have to go off camera audio for a little bit. But yep, we're almost done. So I am charging the microphone. We'll see if we can't get it going here soon. But until then, camera audio. And Mule's supposed to be getting out. Once again, they turned around right before we opened the gate, and I don't know, they're mules, being mules. So this is another little Arab, and treat orientated, likes food.
It's real smooth on this one.
Let's see how this goes. Hi, you're so sweet
It's cute
looking.
that her eyes bulge like that. Side note.
She's like, oh, Dr. Lydia's looking, listening to my heart and my lungs. How old did we age her at?
Haven't fully looked, but Galvian's groove is moving. Can you get her?
What a good girl.
Can I reach from there?
Can I see, please? Maybe 16? What do you think?
And she just got her microchip.
Sorry, that was a big poke. You're a good girl.
Little Arab's going out to the 10-acre pasture. She already knows where the treats are.
Well, you got one of the radios out, and you used to do 10 acres.
Well, she's not running. She's just gonna eat some grass. And who do we
Who's
have
coughing?
here? We're running out of horses.
Yeah, you are exactly right. So lung sounds were normal on that one.
You're very tall.
Hi, big girl. Can we have your head, please? Good girl. Good girl. Here you go, good girl. Oh, you're such a big girl. And I would like to re-escalt her. So Galvani's groove is almost to the bottom, but not all the way. So I would put her at about, 18, 19. Let's look at the other side though and make sure. Your friend is coming. Nope. No, she just has a lot of vascular changes, but she's got scars underneath here like somebody's lip chained her. I'm sorry, Mama. You're a good girl.
She's also making it through the initial intake and assessment, and she's going to be getting everything done to her and going into quarantine for 30 days.
I'll open the gate for you, Haley. Your friend is coming. She's coming, okay?
And she's heading out to the 10-acre
Did you already
pasture.
roll? Easy. No escaping, okay? Oh, I'm sorry. Do you want to go in?
There they go, heading out. Go explore their new pasture.
Yeah, those two are definitely friends.
Last horse, the Mustang coming in.
Caitlin or Haley, can one of you guys calmly come and close the... Yes, thank you very much. Perfect. You don't look very old. Hi, what do you think? Yeah, that's very good boy. Thank you. Oh yeah, we're not very old. You got a tiny bit of a parrot mouth, just a tiny, tiny bit. He is definitely under 14. I need to look at the cups and stars on the occlusal surface of the lower incisors before assigning age, so.
So Haley looked up his brand, and he's born in 2018, so 6 years old.
You're a very good boy. Little poke over here. He's awesome for pokes.
Okay.
No.
And there he goes to the 10 acres.
What a good
Last
boy.
Horse. All 30 horses have been assessed and intake.
He says puddles
like
are a little
he doesn't want to cross
scary.
the puddle.
Good boy.
What a magnificent horse right there.
Oh, flying lead changes. Did you see that lead change, Haley? So we just turned out our last horse. We had 30 horses come in through our buyout program yesterday, and we got through about half of them yesterday, finished up the last half today. We try to prioritize ones that are in the worst shape. So yesterday was a very sad, very depressing day. We had to make a lot of hard calls. Today was a lot more upbeat, and we were able to save almost everybody and turn a lot of them out into the 10 acre. So we're wrapping up. We're gonna go take lunch, and then we'll get all of our blood samples run and paperwork processed.